Hello, my name is Dorina Madrid, and I am part of Dr. Sue Ann Chu's laboratory in the Department of Health and Biomedical Sciences at UTRGV. Today, I will be presenting about our injectable alginate scaffolds for the delivery of minocycline for the treatment of glioblastoma. Glioblastoma multiforme, or GBM, is one of the most aggressive forms of brain cancer. It is classified as a grade 4 tumor, meaning it's highly malignant and poses significant challenges in treatment, which results in poor prognosis. On average, GBM patients have a life expectancy of less than 15 months. The tumor's ability to stimulate the formation of new blood vessels, a process known as angiogenesis, contributes to its aggressive nature and high reoccurrence rates. Today, the standard approach to treatment includes resection surgery and external beam radiation, and occasionally by systemic chemotherapy or a combination of these methods. Due to the infiltrative nature of these tumors, it is difficult for surgeons to completely remove the cancer cells without the risk of neurological defects. Therefore, there is a need for alternative treatment methods. The goal of the study is to develop injectable alginate-based gel scaffolds for the delivery of minocycline for the treatment of glioblastoma. Minocycline is a commonly used antibiotic, has angiogenic properties, and can be used to prevent GBM reoccurrence. By using an injectable system compared to preformed scaffolds, the material can be easily conformed to the topography of the site. We hypothesized that the sodium alginate and calcium carbonate concentrations will have an effect on pH, gelation time, dimensions, degradation, and drug release kinetics. For the methods, the scaffolds were fabricated by preparing various concentrations with a 1-to-1 ratio of sodium alginate and calcium carbonate in water. The solution was mixed using a homogenizer. Next, JDL was added and homogenized, with the mixed solution to assist in cross-linking of the scaffold with calcium ions. 2.5 ml of the final mixture was then pipetted into a 24-well plate to form the scaffolds. For our results, the characterization of the scaffolds is shown in Table 1. The scaffolds were made with different concentrations of sodium alginate and calcium carbonate, kept at a 1-to-1 ratio with the constant concentration of JDL. As seen in Table 1, more sodium alginate and calcium carbonate concentration resulted in increased cross-linking and sturdier gels. As sodium alginate and calcium carbonate concentrations increases, the gelation time becomes longer as there is not enough JDL for rapid gelation. All scaffolds achieve the targeted pH range of 6.8 to 7.2 for optimal drug delivery and approach physiological pH 7.35 to 7.45 after 30 minutes, confirming their biocompatibility. The results from our degradation study in Figure 1 showed that the 2% scaffolds, which had the highest sodium alginate and calcium carbonate concentration, demonstrate significantly less degradation than all the other groups by the end of the 42-day study. As seen in Figure 2, the 2% were sturdier compared to the 0.75% scaffolds. Unexpectedly, the 1% scaffolds exhibited greater degradation than those with 1.5% at day 28, thus suggesting that other properties may have influenced the study at earlier stages. Finally, for drug release kinetic study, we saw that the tested in PBS with calcium, the 2% scaffolds, which has the highest sodium alginate and calcium carbonate concentration, exhibited a significantly lower burst release than all groups as seen in Figure 3a. When tested in phenol red-free media, the 2% scaffolds exhibited a lower cumulative release than the other scaffolds. All scaffold formulations displayed controlled drug release throughout the study period in both PBS with calcium and phenol red-free DME media. To conclude, a higher amount in sodium alginate and calcium carbonate concentration led to a higher number in pH and a higher gelation time and sturdier gel, and a decrease in degradation and drug release. The enhanced cross-linking led to denser matrix, which contributed to slower degradation rate and more controlled drug release. We observe appropriate pH value, gelation time, and uniformity was reached for all concentrations tested. Given these properties, the alginate scaffolds fabricated in this study show potential as promising therapy for glioblastoma multiforme. They can potentially serve as effective biocompatible delivery devices for anti-cancer drugs such as minocycline. Further research will focus on evaluating the release of minocycline from these scaffolds and its impact on viability of GBM cells. Thank you.